We are working towards a world where leadership in global health is diverse, creating opportunities for the global south to have a voice, to shape and influence the services and policies that affect them. We understand our challenges and context the best, and so we should be part of the solutions. The problem that me and my team actually work towards is that healthcare is not accessible to everyone, especially high-quality healthcare. Majority of the Africans on the continent, more than 50%, do not actually get the healthcare that they need. Given that majority of the diseases on the continent are preventable, primary and community health care systems are the ones that could address those particular issues.
If the leaders of the country see health as an investment sector, not as a consumption sector, that's the first step. But the investment is not just more money, it's also about efficient use of the money.
But the truth is, we actually have a $4.4 billion annual funding gap for community health systems at scale. And that is the gap that me and my team at the Financing Alliance for Health is trying to narrow.
All right, so we'll start. How do we influence county budgets?
So the Financing Alliance for Health is a technical advisory firm that focuses primarily on serving governments, particularly supporting ministries of health and finance.
When we're looking at this community health strategy, we reduce the number of home deliveries, we reduce the number of maternal deaths, infant mortality.
Develop financing strategies for government, as well as what would be practical on the ground. Because the government is custodian of the public health system, you cannot ignore the role of government in systems change. Our role is also to be able to not only support the governments to get the right policy and strategic framework in place, but also identify who they need to be engaging with directly and indirectly to be able to implement that strategy. So what we do is, one, we directly embed capacity across ministries of health and finance in different countries across the continent. The purpose of the embedded team member within these ministries of health is, one, to provide the bandwidth within the government team, also the knowledge and skills transfer for the ministries of health to be able to mobilize resources. The second thing we do is we help co-shape regional and global funding flows to reduce the significant fragmentation of the little money that actually exists in the system, which then leads to the $4.4 billion funding gap. Our role is to try and understand, where are these funding flows coming from? How can we actually advocate for better alignment of these funds, and how do we connect these funds to actual performance improvements and meeting of particular targets? The third thing we do is we are strong co-advocates of at-scale community health systems on the continent.
Data on the interventions led by community financing is very, very key. You have to show success stories. Are the communities able to see what those funds are doing?
And so we support advocacy efforts by providing the evidence that's required, providing the tools that requires, and also providing databases.
Frontline health workers, those closest to the communities, are both critical in responding and in being able to meet the critically rejected.
18 months.
Financing Alliance for Health is an organization that has really come at the right time. Laikipia County didn't actually have, a structure on community health strategy. From, developing the strategic objectives to making us realize cost.
So we need to align ourselves with the so-called new and emerging diseases so that we can factor community health strategy.
In as much as we know, yes, there are gaps in CHS Laikipia, they really came out strongly that time.
With the population of the Rakanidi, we need about 1,900 CHVs. So there's a gap of about 700.
They came in to give us inputs, to guide us, and to provide technical expertise to be able to put the document together to understand how much does a CHV require in terms of investment per year, per CHV, for her to be productive.
We know Tharaka Nithi County has been one of the best counties, and we can say thanks to our CHVs, they are really doing a good job.
I believe we'll be able now to move forward with very clearly stipulated steps. Now there is a clear guideline on how CHS should be run.
Now, more and more people are already convinced about the case for community health systems. We have created opportunities for more than 80,000 community health workers across the entire continent.
One person, a CHP like me, you meet you are covering like almost 600 families. And because we have the passion, you want to cover every household. The blessed milk until 6 months, that baby will be very healthy. Our hope is everybody in the community, the health be improved.
I had expected pushback from governments because we don't look like the typical technical advisor, right? On this content, we don't. 85% of the team are under the age of 35. We're not male, which is what typical government advisors look like.
A challenge with tracking actual government expenditure, then these model assumptions can run and track alongside those costings, Waziri.
That is exciting, you know, and I would be very interested to be trained on that.
Okay.
Yes. FAH is an invaluable partner in bringing in the skills of financing the entire system of health so that we do not get bogged down with trying to do things that we are not even trained to do. We cannot do without their assistance. I can for sure tell you that.
I want to be able to create spaces for those in the global south who experience the challenges day to day and who have a sense of what could potentially work, which might not always be the logical solution, which might not always has the right buzzwords, that they actually have a platform to influence the policies that will affect them directly and generations after them.